female. The nature of the animal was street dog, killed soon, and the post-exposure prophylaxis 3 doses were given. Purified chick embryo cell Rabipur 037 and no rabies immunoglobulin was given. The chronology of events were the dog bite, it was a category 3 at right side of the nose, 20 days. Paresthesia of the face, this is 20 days. And fever and restlessness was for 5 days and altered sensorium for 1 day. Now the CSF findings were the total cells 5, monomorphs were 100%, protein was 126, sugar was 71, and negative staining. The diagnosis was rabies encephalitis. The confirmatory test revealed rising serum and CSF virus neutralizing antibody titer of 1:8192 and 1:2048 respectively after 5 days of previous sample. And the MRI findings were bilateral brainstem, mild hypertension intensities, restricted diffusion, or contrast enhancement on day 2. And the modified Milwaukee protocol on day 1, and the hospital survival of 16 days but died after 1 day due to lump. Next case was 38 years male, was bitten by a stray dog, and the status was unknown. 3 doses were given on 037 and no rabies immunoglobulin was given. The dog bite was category 3 at the left mid calf of 15 days, dysphagia and restlessness for 3 days. And the CSF findings were not there as it was not done as the case left against the medical advice. Diagnosis was rabies encephalitis. Confirmatory test MRI findings they were not done, and supportive since protocol could not be started, and lama on the same day of the admission, and death followed after 2 days of going out of the hospital. The third case is a 34 years male street dog whose status was unknown. He was also given 3 doses of vaccine of 037 and no rabies immunoglobulin was given. Dog bite was category 3 at right side dorsum of the foot for 17 days, and dysphagia and restlessness for 3 days, and dyspnea was there. The total cells of CSF were 60, monomers were 100%, protein was 84, sugar was 58, and negative staining. The diagnosis was rabies encephalitis. Confirmatory tests showed rabies RNA PCR positive from CSF and serum but virus neutralizing antibody titers. MRI findings it was not done due to early death. Modified Milwaukee protocol from day 1. The patient expired on day 2 of the admission. The reason of deaths may be due to lack of administration of rabies immunoglobulin or poor compliance to vaccination. This is the original article. Compliance to post-exposure prophylaxis among the animal bite patients, a hospital-based epidemiological study by Dr. Manasi Panda and Richa Kapoor. Here we can see the study was done at Safdarjung Hospital, New Delhi, where 360 animal bite patients were taken up. This is a pre-designed, pre-tested, structured questionnaire was administered by the interview technique. Here we can see the 46% were 48% were compliant, whereas 46% were non-compliant, and 6% were delayed compliant. So 53% were non-compliant to the full course of ARV. Now coming to the next article is the compliance of anti-rabies vaccination in post-exposure prophylaxis. This was considered. This was conducted at Municipal Corporation Hospitals, Bangalore, where 215 animal bite patients were taken up. One dose of rabies vaccine administered intramuscularly on days 0, 3, 7, 14, and 28 as post-exposure prophylaxis. Also measures constraints for compliance to complete course. Here we can see the compliance to the anti-rabies vaccine was only 60 at the day 28, which is very low. 60% were only compliant. What were the constraints for compliance to the complete course of anti-rabies vaccine? It interfered with the school timing for the vaccination, and distance to the hospital was also a major cause. It was around 11%. Cost incurred to 13% because people had to pay from their pocket, and forgotten dates were 18%, and loss of wages, which accounted to by the major share, was around 47%, as people on the day of vaccination had to lose the daily wages. The major constraint for the compliance to complete ARV was loss of wages. Now coming to the evaluation of rabies vaccine, the earlier 1885, the live attenuated vaccine, the spinal cord, is the nerve tissue vaccine, the non-standardized dried preparation up to 31 injections of increasing immunogenicity. And in 1911, the inactivated vaccine brain up to 10% was derived. This is the minimal neural content liquid preparation. Around 14 injections each of 0.5 ml daily were given. Now coming to the cell culture vaccines, the inactivated vaccine cell culture of more than 2.5 IU. The standardized immunogenicity is lyophilized, and here 5 injections were given on 0, 3, 7, 14, and 28 days. The non-compliance led to the evolution of treatment regimen, which was the longest period of 31 dose to 5 dose and still on. Now coming to the meeting the unmet of the medical need. So what is the need? Should be shorter and more compliant so that people could complete the whole course. The introducing a novel vaccine with simple and shorter regimen. The novel 3-dose recombinant rabies G vaccine. Here we can see the first protein subunit vaccine, and it is prepared by the VLP platform technology. The first vaccine with 3-dose intramuscular regimen, that is 0, 3, 7 days, and the better compliance due to easy to flow regimen and less visits. The convenience, ready to use, and no reconstitution was needed. Now coming to the native virus, this is the rhabdovirus. Here we can see the G protein is difficult to stabilize, and the G protein isolation using the VLP technology purified and stabilized by the Cadla Pharmaceuticals Limited. The virus-like particles VLPs are protein complexes exist as nanoparticles. The VLPs are similar to the native virus particle, but that do not contain the viral genome. They cannot replicate and can mimic the viral antigenicity without being pathogenic. They are capable of introducing a strong humoral and cellular immune response. They VLPs as the vaccines. Now coming to the clinical phase 2. Here we can see the study design of 10 microgram for 0 to 3 for 2 doses, and was carried for 50 cases, and for 0 to 3, 0, 3, 7, this is the 3 doses of 10 microgram was given to 50 cases in the deep blue, and the 50 microgram was given for 0 to 3, 0 and 3, for 50 cases, and 50 microgram was given for all the three doses, that is 0, 3, 7 for 50 cases. Here we can see the seroprotection from day 14 for the post immunization after the completion of the vaccination, from day 14, day 42, day 90 in all cases, that is 10 microgram for two doses, 10 microgram for 3 doses, 50 microgram for 3 doses, 50 microgram for 3 doses, and Rabipur 2.5 ml for 0, 3, 14 and 18 and 28. Here we can see at the day 270, almost all the doses, all the classes were at almost the same. Now coming to the clinical study phase 3. The safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. A randomized comparator controlled multi-center phase 3 clinical study. This is to evaluate the immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. This is a randomized, comparative, controlled, multicentric study where 800 cases were taken up and randomization was done for 2:1 cases. Here we can see in the 0, 3, 7 days regimen, 533 cases were given Thrabis, and in 0, 3, 7, 14 and 28 days regimen, Rabipur was given to 267 subjects. Now coming to the results, here we can see the efficacy in the Thrabis, which is seen in the deep blue color, and the reference vaccine, which was given for 0, 3, 7, 14, 28 days, 28 days were having seroprotection on day 14 as well as day 42, almost the same. Now coming to the adverse safety profile, the adverse events here as compared to the Thrabis and Rabipur, here we can see the Rabipur had more adverse effect, that is 17.2 as compared to 9.9 adverse events in case of Thrabis. Now coming to the local adverse events, here we can see the localized pain in the injection site was less in case of Thrabis as compared to the reference vaccine of 0, 3, 7, 14 and 28 days. And next is the redness of the area, which it was also low, and swelling was also low in case of Thrabis as compared to the reference vaccine. Now coming to the systemic adverse events, we can see fever was very negligible. It was around 0.38% as compared to 1.50% in case of the reference vaccine. And the ear pain was bit on the higher side in case of Thrabis. Headache was very less in case of Thrabis. Urticaria was bit more in case of Thrabis, and joint pain, nausea was not seen in case of Thrabis. So novel 3 dose was better safety profile as significantly less adverse events compared to the reference vaccine. Now coming to the study conclusion, the novel 3 dose was non-inferior to the reference vaccine. The less adverse effects compared to the reference vaccine. The novel 3 dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. And this product was given the Pharma Innovation of the Year and the Golden Globe Tigers Award Malaysia for the Innovative Product of the Year. Thank you.
So with this, sir, with your support or your permission, sir, we want to close the meeting, sir. Thank you so much for your valuable time, sir. Thank you so much, sir. for the informative talk. We truly appreciate you for your efforts. Last but not the least, sir, we would like to inform you that our Thabis has won as you told, sir, two prestigious awards in innovation category, ET India Pharma Award and a Golden Globe Tiger Award. And thank you, sir, for a valuable time, sir. Not taking much of your time, sir. When we will go to next to you, sir, we will meet, sir, and have a better discussion. Sir. Thank you, sir.
Thank you and namaskar.
Thank you.
तो मीटिंग क्लोज कर दो ना.
हाँ.
ओके, थैंक यू सर.